Welcome to Black Health Matters. I'm your host, Darryl Armistead. This is a Howard University Hospital transplant support group session led by Dr. Clive Callender, who is a noted transplant surgeon and professor of surgery at Howard University College of Medicine. Let's join today's session in progress.
Three interesting articles in the Washington Post. The first one was on insomnia, and we've been talking a lot about how important sleeping 7 to 9 hours a night is, and how good it is for your brain and the rest of your body. But insomnia, or the inability to sleep 7 to 9 hours, it's very important problem that 1 in 5 adults has difficulty sleeping and staying asleep for 7 to 9 hours, and they not infrequently will wake up at 1 o'clock in the morning. And so this article shares some tips for what to do when you wake up at 1 o'clock in the morning and you have difficulty going back to sleep. Uh, he recommends inhaling through your nose for 4 seconds, then holding your breath for 7 seconds, then finally exhaling through your mouth for 8 seconds. And the author says if you repeat this until you fall asleep, it works 100% of the time for him anyway. And usually by the second time he does it, he's asleep. Um, I think that that's one remedy that he recommends. The second is that uh, is that and he talks about the reason that this is effective is because it slows your heart rate and lowers your blood pressure and allows you to fall asleep again. Uh, then if that doesn't work for you, then he recommends to avoid looking at your smartphone and looking at the clock, but or even going to the bathroom unless you have to. And then he said, try rolling onto your back and counting to 30. And if that doesn't work, then he talks about trying to relax your body for 5 seconds, tense a part of your body for 5 seconds, and then release the tension all over your body. Of course, uh, this he recommends as well as the breathing exercises. Um, then finally, you mentioned that one night of bad sleep is not going to hurt you that much, and that occasional bouts of insomnia are normal. But if you find that none of these work, then you should see a psychologist and have them uh, work with you in terms of combating your insomnia. John Buchanan and Darryl Armistead, who's
Yes,
first?
one of the techniques you just mentioned about tensing up part of your body and relaxing, that's one of the things I've learned in yoga when we do shavasana at the end for meditation, tensing up individual muscle groups, that really helps. And gee, I'm gonna let Darryl go and then I'll remember what else I was gonna say. Go ahead, Darryl.
Darryl?
Yeah, on that 478 breathing method, I use that and it's effective. A couple of things you want to remember when you do that. The four, when you inhale, do that through your nose. And then the seven, when you hold your breath, um, do it very gently. What I mean by that is you'll have a tendency to close your throat when you hold your breath. But after you inhale, just leave your throat open. Just bring yourself to a stop, and then gently exhale through your mouth like you were blowing a feather. And it can be very effective. You may need it more than twice, but you keep doing it, and the next thing you know, you'll be asleep. Um, I know the study didn't mention it, but a lot of people have sleep apnea, and they tend to be snorers, and that can be very serious. Sleep apnea can lead to stroke or heart attack, and so you may need to get with your doctor and possibly consider a sleep study.
Thank you for sharing. Very good. John
So,
Buchanan, you remember
yeah,
your
to back that up, yeah, I've had a sleep study and I have mild sleep apnea, even though a couple of my roommates have woken me up saying that I'm snoring really loud. But one thing that helps me is I use a sleep mask. Just goes over your eyes. It's totally black, and that you might not have lights from the TV or uh, from the street lights or whatever, but that sleep mask allows me to sleep all the way up to the very end of my sleep period, even when the sun comes up. It blocks out all the light. And one of my physics professors told me his wife did that. So I tried it out and it really works. It helps. Thanks.
Thanks for sharing. Any other comments or tips about sleeping? Okay, the second article is uh, what to eat to allow you to sleep better. And this article talks about the fact that we naturally produce melatonin that helps us sleep, but that fruits and vegetables, nuts, seeds, fish, eggs, and milk tend to help. Uh, those are the foods that help promote sleep from their perspective. Uh, I think that's something that we've long talked about. They also talk about foods that are high in tryptophan, turkey, chicken, uh, cheese, egg whites, nuts, and seeds, and as well are associated with being able to sleep. Does it matter what time of day you sleep? Well, most of the studies suggest that stop eating at least 3 hours before bedtime is wisest uh, advice, and that there are foods that interfere with sleep, like caffeine, and sugary drinks, um, and ultra processed foods. Uh, all uh, keep you from sleeping. And then, of course, having a routine at a time at which you go to sleep is also helpful as well. Uh, any additional thoughts in terms of uh, how and your eating and what you eat and what you don't eat interacts with your ability to sleep 7 to 9 hours a day? No comments on that, and then uh,
Yeah, I got a comment.
okay.
Eating a heavy meal before sleep, that could trigger a heart attack, particularly if you've got pre-existing condition like hypertension or other pre-existing heart disease. So, not a good idea. Eat that heavy meal before going to sleep.
And aspiration uh, will kill you as well. So the best advice is as Darryl suggested is, and the article suggests is about 3 hours before you go to bed, have your last meal. Uh, The last article, if there are no other comments, is the fact that we've been talking recently about men and about women and the fact that they can get heart attacks and strokes at lower blood pressure than men. But they had a study that involved 5,000 black and white men and women from age 18 to 30, who they've been studied since 1985 for 50 years. I'm sorry, for 30 years, that's right. And what they identified is that men start having heart disease earlier than women, and they start in their 30s to start uh, having plaques in their coronary arteries. And this happens by the age of 35 for young men and around 50 for women. So they recommend that young men should not wait until they're 50 to worry about heart disease. They should start when they're young adults. And so they recommend some of the things that we've mentioned almost every week. Having a heart healthy diet, fruits and vegetables, exercising the 150 minutes a week, uh, not smoking, uh, as Darryl far too frequently mentions, maintaining a healthy weight, BMI between 25 and 30 or less. Uh, Controlling cholesterol levels, keeping your blood cholesterol normal, having a normal blood glucose level, keeping your blood pressure uh, normal. And then, of course, last but not least, is getting 7 to 9 hours of sleep a night. So these are the things that are particularly important for men, important for women too, but more important for men because it appears that they start having heart disease much earlier than women. So you women try to keep your men in your life healthy. That's quite an undertaking, but anyway, it's what they recommend. Any comments or questions about that? If not, then let's go to the articles. Oh, yeah, this is the article that Anissa Durham authorized on borrowed time, talking about transplantation and organ donation, for which she won the NAACP Image Award for journalism. It's the inaugural award she got, and it's the article that I think most of you, Buchanan had shared with you, an extensive article about waiting for transplants and all the work that we've done through the decades in terms of getting blacks to donate organs for transplantation. And for her to be recognized in this fashion was very great for her. And happy that the article that included us was a source for education for a number of people. So, so we just shared this. Any comments or thoughts about uh,
I think it's long overdue that this type of focus gets out on the media, and it should be on Netflix and uh, other mass productions across the world. Everybody needs to see this. It's really fantastic.
okay. Thank you for sharing. Okay, I guess we can go to the next article. This is a very interesting article that occurred as a consequence of the committee that actually looked at transplantation and found uh, transplantation in the United States to be inequitable. And one of the things that they required that be done was to eliminate race-based kidney testing. And as a consequence of that recommendation, uh, you can see that 5.3 transplants per thousand listings occurred. As a consequence, uh, 7,000 people received a new kidney during the study period. And uh, what it identified is that having a GFR that was felt to be race dependent was an obstacle to uh, people of color getting transplants. And when they eliminated this obstacle, more Black patients got transplanted. And so this further identified that the transplant system was not yet as equitable as it needed to be. And this is just another example of people doing things that they think were for the right reason, but turning out to be uh, harmful. And so many Blacks now have received transplants as a consequence of eliminating that so-called race-based GFR obstacle. Any comments about this very important article that shows that how harmful racism can be? John Buchanan?
Yes, Dr. Callender, we talked about this even a couple of years ago, but I was just wondering if you could maybe enlighten us on how that GFR actually works. And you said some people thought it was a good thing, and it turned out to be bad. What's the deal with it?
Well, what it was is that they felt because Blacks had more uh, muscle mass that their creatinine needed to be uh, lower than whites. That to oversimplify it. And so they had one level for white patients, and they had an even lower level for Black patients. And this then resulted in uh, Blacks waiting longer for transplant than anybody else. And when it turns out this was inappropriate because the GFR should be the same whether you're black, white, green, or purple. And once the Society for uh, Medicine and scientists found out about this, they said stop doing that and use the same glomerular filtration rate, which is the rate in which your kidney clears creatinine for all ethnic groups, regardless, and don't have one rate for Blacks and one for whites because of what you think is appropriate. And so when they stopped doing this, they then found out that this had been an obstacle and kept Blacks from actually getting transplanted. That's a way of trying to oversimplify what what it was all about. They meant well, but the road to hell is paved with good intentions. Uh, Dr. Perez?
You know, when you see articles like this, I remember being taught in medical school that in the National Medical Association, we published on this, not with GFR and transplant, but that we could hold back pain medication from Black patients because Black people are stronger, especially Black men. They don't feel the pain. They've been through slavery. They can handle it. They know what it's like to be in the field. I mean, some of this stuff is so disgusting. We don't have to worry. Black people can handle higher blood pressure. Oh yes, for white people it might be 130 over 70, but Black people, oh, they're more animalistic. And when we translate that to our people, then I think it's one thing to lose something or be mistreated, but when somebody is doing it and putting it in your face, that's what our community needs to appreciate. Racism has been killing us for generations. And I doubt that it's on good intent.
Uh, okay, thank you for sharing. Any other comment? So true, so true. Well, anyway, the practice is no longer done, and as a consequence, more Blacks are getting transplanted, and we need to be sure that there aren't any other obstacles for our people of color in other fields. This is what happened in kidney. There are other areas that have the same kind of problem. This is an interesting article by Cleveland Francis, who is a nephrologist who actually is also a musician, who's has made many records, but he's a physician as well, and he talks about what you folks have talked about on a number of occasions. The fact that people go to doctors' offices these days, and the doctor don't put a hand on them. They come in and go out, and the doctor never examines them. And he says that this is bad, and this is the antithesis of what the art of healing is all about. And uh, it makes a good case for it, as many of you have already articulated that you can go to the doctor these days and the doctor won't touch you, and that's not the way it should be. And so, any comments about this great article written by a singing physician?
This reminds me of Star Trek, where they have the tricorder, that little device that you can just scan it over somebody and it'll tell you exactly what's wrong with them. That's the AI of the future. But it's almost happening now. Remember when COVID had happened? You to take someone's temperature, you used to have to put the thermometer in their mouth under their tongue. Now you just scan their forehead. And with the tricorder, they can do more than get your temperature. They can tell everything that's wrong with you through artificial intelligence. So
Not really.
I'm
Not
talking
true.
about I'm just talking about the tricorder of the future.
Oh, oh,
I'm not, I don't mean AI now, but AI is rapidly expanding. And as you can see, it's coming up every week in our discussions. So it could be coming. And at the bottom of this article, it's got some of the Dr. Francis's music, in case you're interested.
Dr. Perez?
I know it had gotten to the point when I saw patients and they'd be prepared in the room and I'd come in and they'd be completely dressed and I'll tell them to get undressed. And well, what's wrong with you? What's wrong with me? Because I am telling you to get undressed so that I can see you. I can learn. I mean, we learn so much, so much. You know, I can give instructions on how you should bathe. I mean, it's we're going in the wrong direction. And AI and our comfort with not being appropriately cared for and being comfortable with a whisk of a probe instead of the experience that a physician has had in taking care of people. Is your skin tempting? Are you dehydrated? There's so much. Are there bruises on your body that nobody picked up, that you're getting beat up at home? Uh, uh,
Thank you for sharing. Any other comments? And that's what Dr. Francis is talking about. And the combination of the doctor and the AI is a great combination, but one without the other is not going to work. And the fact that these days you go to the doctor and the doctor doesn't examine you at all is still counterproductive. But that unfortunately is the way things are moving. Any other comments about this article? Okay, well, let's go to the next one. We are finally getting to the point now that we are now trying to find ways to eliminate the microplastics that have become part of us. 97% of us have microplastics as a consequence of interacting with plastics. And so we're now beginning to do studies that identifying ways in which we can decrease the amount of microplastics that has been found to be dangerous to us. The extent to which we aren't knowledgeable, we do know that it is associated with uh,
What's going on, Uncle Clive?
It's Chris.
It's
Hi.
Chris CJ.
Hi, how are you?
Doing good, man. I see my grandma. Yeah, I see my grandma back in the group, so I had to peek my head in for a quick second.
Okay. Good
All
to
right,
see
take
you.
it easy, man.
Okay.
Okay.
All right. So now that we're aware of it and we are trying to find ways to eliminate it and eliminate our emphasis on using plastics, we're beginning to find ways to neutralize some of the toxicity of plastics. Emphasizing the use of sauerkraut, kimchi, and yogurt, probiotics that may mitigate against the toxicity of micro of, microplastics. We've got a long way to go, but at least we're beginning to spend time in finding ways to decrease the fact that plastics are toxic to the body. And this article kind of talks about how yogurt and other uh, probiotics can help eliminate the microplastics. Darryl?
Yeah, if you're not familiar with kimchi, it's a fermented Korean vegetable dish. It's very similar to sauerkraut, and sauerkraut is another probiotic. So, if probiotic foods can help you eliminate microplastics, if you're not a fan of kimchi, you might try sauerkraut.
Thank you for sharing. Any other comments? Because this is uh, what's one of the first of articles that is trying to identify how to rid your body of, of these plastics, which are dangerous for us. Hopefully, we'll have many more articles like this that will identify ways in which we can decrease the amount of plastics we have in our bodies. It's been found in just about every tissue that we've looked at it for. John Buchanan?
Yes, I was wondering, okay, so you eat the kimchi or the sauerkraut. Uh, can that actually get the microplastics or nanoplastics out of the organs that are already there, like your brain? Can sauerkraut get the plastic out of your brain or liver or kidneys or other organs of your body?
Yeah, the only question is to what extent. Yes, there's evidence now that it does increase the excretion. To what extent, though, we have not done enough studies on it. This is one of the first studies that has identified that these probiotics increase the GI excretion of the uh, microplastics. But this doesn't quantify the extent to which, in other words, does it take out 1%, 5%, 10%, or 50%? Those are unanswered questions that we need to have more studies on. Betty Blaylock? Betty Blaylock, your hand up.
Betty's hand up. Betty, you're still muted. You got to unmute, Betty.
Okay. If there are no other comments, that's an important question that you asked, and hopefully we'll have more studies that can actually tell us the answer to your question, John, in terms how much. In other words, are we losing 1% of microplastics, 10%, 20%, 30%, 50%, and so forth? And are we losing it from any place other than the GI tract? Because this study is demonstrating what can happen in the GI tract. How does that impact the other organs, which is what your question is? And hopefully further tests will clarify that answer, which we don't have yet. Dr. Perez?
I appreciated the cultural aspect of how important kimchi and Korean people and just beginning to meet people kind of where they are with what their diet is, and appreciating its impact on the community, and how we can, support that in families instead of, just our fast food, our, because it's something that can be around as we, get rid of the Big Macs and the um, Burger Kings. And so anyway, I just thought that using cultural components with what we do to make us healthy is very important. The foods we eat.
Thank you for sharing. Okay. Uh, we can go to the next article then if there are no other comments. This is an article that suggests that multivitamins may slow biologic aging in older adults, although the studies are talking about months of slowing of aging, uh, which uh, which is not all that impressive, but at least it's slowing aging. This is one of the few studies that demonstrates a benefit of multivitamins. Prior to this, there was very few studies that demonstrated the value of multivitamins. So this is one of the first ones. And slowing by 2 to 6.6 months is better than zero. So it's progress.
You
Any
get a lot done in a month.
Okay. Okay. Darryl?
Yeah. Betty says, now I can't get my sound to work. However, I just wanted to know if there was another food that could help the plastics since I don't like sauerkraut. And here, yeah. So some other foods can be, ooh, okay. This is from the internet. High fiber foods such as okra, berries, lentils, and oats help bind and expel microplastics from the digestive system. So it doesn't address John's question about from the brain, but it will, that's directed towards eliminating it from the digestive system.
Thank you, Darryl. Thank you very much. Okay. Let's go to the next article then. Then we'll have the comments. This is an article that talks about the fact that we are kind of concerned about cancer warnings and alcoholic beverages, but we're not too interested in banning billboard ads about alcoholism. And it's because the public doesn't recognize that alcohol is bad for you and it increases the likelihood of cancer and a lot of other bad things. So we need to do more PR in recognizing that alcohol is associated with cancer and other diseases that make alcohol, having any alcohol uh, something that is toxic. And we become more tolerant of the dangers of alcohol than we are willing to recognize. And this article is suggesting that we need to be more more knowledgeable about the fact that alcohol is harmful, not only for cancer, but for many other conditions. Darryl?
Yeah. Before you go to the doctor, you always get the pre-check in where you have to answers a series of questions, and I noticed that there's always questions about do you drink alcohol and the amount that you drink. It asks for like how many drinks a week or a day, whatever it is. Um, easy question for me because my answer is always zero. But uh, is that something that you think doctors are more inclined to discuss with their patients? To tell them straight up, any amount of
I,
alcohol is bad for you?
I think that we aren't doing it enough. I think your point is well taken, but we as a group are not doing it enough. We should do it more. And we should be less tolerant of advertisements that, as you know, for all of the sports channels, they always talk about drinking alcohol. And alcohol is not good for us, but I'm not sure that we as physicians uh, always emphasize the fact that alcohol is harmful. So thank you for sharing your point. Okay, let's go to the next article then. It's interesting that finally one of the judges has strike down Kennedy's vaccine policies. The question is, uh, when they take it to a higher court, will this be upheld? And so I think it's going to finally wind up in the Supreme Court. And uh, but I think this is long overdue. Uh, and so it's going to be interesting to watch this battle as it goes up through the judicial system. But they clearly articulated the point that much of what Kennedy has done has been done without basis, without scientific evidence. And but the battle has just begun. So it's going to be interesting to see what happens. Any other comments about this judicial action? To me, that's long overdue. Right, Perez?
And like the previous um, article where you talk about alcohol and the use of alcohol, an alcoholic is somebody who drinks more than you do. If you're a physician, you know, so it becomes your behavior. Just like it's either right or wrong. And we can see how easily politics is now being the deciding factor for not just a small group. I mean, it is the secretary's practice. Legislation is written where certain policies are dependent upon the position of the secretary. It's not written in Kennedy, it's written in the secretary, the particular office. That's what impacts who's going to pay for the vaccine. So I mean, it sounds. It's important for us to appreciate that impact on our health. And we've talked about the glamorization of cigarettes in the 50s. You weren't cool if you didn't have a cigarette holder or so that you had the long cigarette. What is the name? Channing, and just the popular culture associated with behavior that's harmful.
Thank you for
Thank you for
sharing.
sharing.
Any other comment? Okay, we anxiously await uh, as this goes up the judicial ladder to see what happens. But one thing that's clear, we cannot sit back and not oppose uh, these actions by this administration. Okay, let's go to the next article, please. This is an article about dengue fever that has been increased in locations outside of the United States. And this article identifies uh, Vietnam, Cuba, Colombia, and other locations, including the U.S. Virgin Islands uh, and Cuba. And you see them all here. A warning that um, people coming back from these areas testing positive for dengue fever, a disease that is hard to treat. And so the warning is that if you go to any of these locations, that you're at risk. And the treatment involves IV fluids, rest, and Tylenol, but it's something that we have kind of done away with for a while, but uh, it's a medical emergency if you get it. And so those who travel have to be aware of dengue fever as a possible consequence of mosquito bite. Yes, John Buchanan.
Yeah, I remember, I think it was a couple of years ago, we had an article about the California universities that were developing the mRNA technology. Maybe it's more than a couple of years because I think it was before COVID. So maybe 6 years ago, we might have started talking about it. And it was, excuse me, supported by uh, President Obama. I remember that. And the Ebola that was so frightening and powerful and deadly, also, spurring a lot of research into, new methods to handle this kind of disease. And dengue, I think, was in the Caribbean. I'm not sure the islands that it was on, but it started to come up to the United States, like Florida and Southern California. So they said, yeah, we got to fix this, and they rapidly developed that technology. I mean, it had been in the research realm for a long time prior to this, but the mRNA technology just blossomed, and without it, we would be we wouldn't be living. COVID, showed that, but even before COVID, the dengue was handled with that type of technology, biotechnology. And Dr. Atto also knows about that. The immunological research to help to develop those new technologies is really cutting edge of science. And a lot of people don't understand it. So the people that don't understand it put it down. And
Well,
that's
One of the problems is that this administration has put it down.
That's what I'm talking about.
Yeah, well, yeah, but I know, but I'm just pointing out that that's what this administration is opposing. And one of the more recent mRNA tests was not studied or accepted out of hand, not because of scientific evidence, but because they felt that mRNA was not desirable. And so the point you're making is a good one that except the fact that offhand the administration has put down mRNA. Of course, more recently, they have had second thoughts about it. And so uh, let's hope that they're not going to go backwards. Okay, let's go to the next article. This is another article that identifies the fact that cardiovascular disease among women is not adequately addressed. And that while it is addressed in general, it is not addressed specifically as it relates to women. And this article is a plea to get more gender specific issues relative to women's blood pressure. And of course, the idea that diversity is a curse would defeat that. And so let's hope that the point gets across that we need to do more work on the impact of hypertension in women because it's very important. And this study emphasizes again some of the work in the past that uh, women with lower blood pressure than men still develop cardiovascular disease. And this this has not been done to the extent to which it needs to be done in women. Uh, um, so let's hope that the message gets across and that our administrative politics will not prevent us from doing more studies in women to understand why women have uh, cardiovascular disease at lower blood pressures than men. Dr. Perez.
DEI. And I don't know if we appreciate that the taxes that you paid on anything that you bought or a service that was performed for you yesterday is your investment in research. So our tax dollars go to where we put money in research. That should not be dependent upon somebody's politics or their issues with gender or race. It's return on your investment. I want a good return on my investment, my tax dollars, and I know that's DEI, not white mediocre men.
Well, your administration has said DAI is irrelevant, and they're not interested
Vote,
in
vote,
funding DEI.
vote, vote.
It's getting to that time. So Catherine?
Our administration also says that science is not important, period.
Yeah, right. Yeah, they say that too. You're right.
That's
Which is
because they're
frightening.
hating.
It's frightening. Yeah. Yeah. That's what we're against. So we have to vote accordingly. Okay, any other comments? If not, we'll move on. This is an interesting article that talks about loneliness and social isolation among women entering menopause is one of the most important causes of brain health deterioration, cognitive decline, and emphasizes the fact that loneliness is one of the greatest negative impacts that is impacting menopausal women. But that's not true just for menopausal women. It's true for people in general, but especially pointing this out in menopausal women is an important contribution uh, because it might be lost. That here again is a group that isolation and loneliness is a critical negative factor. And so as we address the administration's inability to address these issues on point, it just emphasizes that changes must be made. Because we can't ignore science and research just because of ideologies that are different. Any comments about this article and its recognition that that this something that applies to everybody, applies particularly to menopausal women? Okay, no comment. Okay, let's go to the next article then. This is an interesting article because here again, we're talking about something that impacts women differently than it does men. Osteoporosis, particularly in postmenopausal women, um, is a common cause of fracture, and a fracture in elderly is a common cause of death, and therefore, how you handle uh, how often do women get bone density checked, and if they have bone density deficiencies, are they getting the osteoporosis treatment that is necessary? This article examines the high fracture risk rate uh, in spite of oral bisphosphonates, which is one of the treatments for it, and identifies the fact that sometimes that's not enough, and you have to go to other medications in order to prevent fractures. And this is a particular problem, especially since many of you have gotten densities and have found that your bone densities are lower than they should be, which means that you need to have medication, and medication that will prevent fractures in the long run. And this then becomes very, very important. And so that's why we shared this article. John Buchanan?
Yes, it to me, it's not clear how a medication can help strengthen your bones. I don't understand. Can you tell us about that? How does that work?
Yeah, well, it's clear based on the study here that sometimes the bisphosphonates are not enough, and that if after a couple of years the medication is not increasing your bone density, then you will need to take uh, additional medication, which they identify in this article, and which means that you need to be closely followed, particularly women who are menopausal, postmenopausal, need to be followed, and their bone densities followed. And if the bone density is not getting better, then they have to be switched to stronger medication. They identify the Romosuza, there's a monoclonal antibody that apparently works in increasing the bone density, which is an important aspect of why you get fractures. If your bone density is higher than 2.5, the likelihood of getting fractures is decreased. If it remains lower than 2.5, then the likelihood of you getting fractures is increased. And so having somebody follow you and look at your bone densities in a serial fashion and identifying whether or not the initial treatment is working or not becomes a critical factor in reducing the likelihood of you getting a fracture. And a fracture uh, increases the likelihood of death and infection.
So how do you actually measure bone density? How does that
Oh,
work?
you have a that's a test that is done on postmenopausal women that identifies the extent to which your bones are soft or not. And if they're soft, which means your bone density is lower than 2.5, then you need to have medications that increase the uh, bone density so that your bones are not soft and you don't get broken bones.
Uh, I'm having trouble imagining how you're going to test whether a bone is soft or not. You
Oh,
put
they
it
have
under the
tests.
microscope.
There's a special X-ray that they
Oh,
have
it's a,
that measures the bone density. And if your bone density is less than 2.5, then that means you're likely to have a fracture. And so a serial follow-up of your bone density will allow prevention of the fracture, which is dangerous. Let's see, who should we start with? Catherine, you
I
had
was
a,
just going to say that periodically my doctor does order the bone density test. I can't remember how often, but periodically she does order that. Um, and I have it at the same place that I have my mammogram.
Mm-hmm. Yeah.
do you know what the result is?
I was looking for at my chart to see, but because I don't remember.
Okay, because
But she didn't prescribe anything extra because I do take calcium.
okay, so your bone density may be okay, but uh, I think the importance of this study is that if after since you're not on any medications, it suggests that your bone density is normal.
Mm-hmm.
Uh, but if your bone density were not normal, then you would have to be on medications to prevent you from getting a fracture. Joyce Brinsfield?
Yes, I just had one done on yesterday, and I'm so glad that you're having this discussion because I'm still uncertain about the bone density and the levels because according to the doctor who does my testing of my bone density, she indicates that it is low. and she is recommending that I take some medication. I have not done my research yet. But from what I'm hearing from other people, there are a lot of side effects from the medication to um, improve your bone densities levels. So, Dr. Callender, I may have to get with you to talk with you a little bit more about this because I am looking at the medication that she has prescribed and wanting to know more about it before I start on the program.
Okay, thank you for sharing. Darryl?
Yeah, my comment is what I generally hear about postmenopausal women and osteoporosis is that they're generally on calcium supplements, but I don't generally hear about hormone therapy with estrogen because that's the real cause of the osteoporosis because you're not producing estrogen like you used to before menopause. And, so with this group, is anybody on estrogen therapy?
And what they are recommending is actually bisphosphonates uh, for increasing the bone density. And then if that is not adequate, then monoclonal antibodies that increase the bone density.
Yeah.
Uh, Carol?
I think about 20
Go
years
ahead.
ago, there was a heavy bias against hormone therapy, thinking that it might cause cancer. And I just wonder if that's still at play, while, as a reason
No,
why it's not very often suggested that postmenopausal women get hormone therapy.
that is not part of the therapy for bone density improvements. I can't answer your question as to why it's not, but it's not part of the therapy for increasing bone density. Carol, you are next.
I think Dr. Perez was before me.
Oh, Dr. Perez?
Oh, please go first. I've been talking a lot.
I had low bone density, and I had to take once a week all 100 or something like that. And then it improved, and then a doctor suggested that I take Prolia. It's a shot every 6 months, and it has drastically improved. And I'm doing because one time I fell, I was in a choir stand, I was carrying some books, and I broke my arm and they did the bone density test. So I get a bone density test at least once a year or something while I'm continuing with this Prolia. And it's better than taking that medicine that was once a week. So I just go in there and get a shot for bone density and it's really improved.
Great. Okay. Dr. Perez, thank you for sharing, Carol.
Prolia is about $10,000. It's very expensive. I wanted it too. But instead, I had to take the medicine, which I've been taking. I think I'm towards the end of my 4th year. I have to take it for 5 years. And I have a girlfriend. It's very hard to find a rheumatologist that will follow you. Our issues with continuity of care means we as postmenopausal women must demand it. And I have a girlfriend, a close friend, who, while she was putting up Christmas decorations, took a fall and broke the largest bone in her body.
Mhm.
And the number one cause for Black women being bedridden is hip fractures from osteoporosis. So I've gone from osteoporosis to osteopenia, which from my rheumatologist told me it will never change. But after these 5 years, at least, like a bidwist player, I'm on even board. So I am saying, my beloved sister Joyce, don't be lack with this. because a simple fall could be traumatic. I mean, completely change your life. So it's very important. And DEI has made us focus on this issue because there are women making decisions about it.
Thank you for sharing. Janice?
Yes, with my doctor, taking bone density tests is a part of my regular physical regimen. And I've been doing it for several years, but it's not every year. I'm not sure if it's 2 to 3 years. And I did have one this past year, and I was running around trying to get my numbers, but at the same time, I was trying to listen to what everyone is saying, and I didn't get a hold of my paperwork. But I do remember him saying that it isn't too concerning right now, but I have low vitamin D levels anyway. So he said continue to take the vitamin D and Citracal. But I do get the bone density test every couple of years, and it's harmless. It's like an X-ray.
Okay. Joyce, you had another comment?
Yeah, I just want to thank everyone for their comments because I am very concerned about it because I have a good diet and I exercise and I do take calcium supplements. And it's just amazing to me that she is pushing this as hard as she is. But I thank everyone for your comments, and I will probably end up going on the program, but I want to have all my I's dotted and T's crossed before I start this regimen. But thank you all for your comments. They were very helpful in helping me to make a decision.
Okay, thank you. Any other comments before we go to the next article? Catherine?
I was just gonna say, I did find my test and I put the information in the chat as to what the levels they have in there are, in case you want to look at the chat.
Looking now.
I don't see it.
I don't see it either.
I don't see it.
Oh, wait a minute. Yes, I do.
Oh, you see it? I don't see it.
No, no, this is something else.
Yeah, okay.
I don't see it.
I don't
Now
see it.
they're there. I'm sorry.
And now I see it.
Oh, I see. Oh, I see the levels. I don't see yours particularly.
Oh, I didn't put mine in there.
No. Oh, okay. All right. But those are the levels, yes.
Okay.
I had some in my neck that were 1 point something, but the rest of them were under 1.
Wow. So you're
I do
pretty.
have a copy of my scan results, but I have not taken a chance to look at them yet. I just had them done yesterday afternoon. So this is going to be very helpful. Thank you very much.
Right. So that the 2.5 is the level above which they want you to be. Okay. Any other comments? If not, uh, great discussion. This is an interesting article that there was also an article in the Washington Post about this, about the fact that whenever the temperature goes above the 90th percentile, you have more suicide. And when it gets above the 99th percentile, you have almost 100% increase in suicide risks. I was not aware that rising nighttime temperatures precipitates suicide calls. I don't know about any of you, but I guess a lot of this uh, depends upon whether you not have air conditioning in your house. And if you don't have air conditioning, then this becomes an issue. And it's people who don't have the air conditioning who are likely to fit into these categories. And you can see youth, women, and Black individuals uh, uh, are those who are more commonly. I don't know how many of you have had any exposure to people who are suicidal, but with the hotline, um, the hotline calls have increased dramatically. But as we approach the summer, when temperatures get above 90 and 100, then this impacts the suicide issue. Any comments about this? Right now we're not near there because we're still in March and April, but especially in Chicago in the summer, it gets pretty hot. And if the homes don't have adequate air conditioning, then this suicide issue becomes an issue. They this is generally one of the articles. The Post said that the warmer it gets, the more people get lazy, they exercise less, and they die faster. Carol?
So you're telling me in America or countries that do not have air conditioning, they're just used to it and they don't have a tendency to kill themselves. We're such a soft country that if it gets hot, we kill ourselves? Or what are
Yes,
you saying? Okay.
yes. Those are the facts. Whether we like them or not, those are the facts. Yeah. That's hmm,
That doesn't make
yeah.
it, does it really make sense?
It's a fact. Whether it makes sense or not, it's what happens. That's what the data indicates that generally, the hotter it gets, the more likely we are to die.
In America.
Yes,
Okay.
we exercise less, we do everything less, and we die faster.
Okay.
Yeah, and as a matter of fact, the article in the Washington Post said exactly the same thing this Monday. Like it or not, that's the data. Darryl?
Okay, maybe because in America, people live and sleep upstairs more. I remember growing up as a kid in the summer before they invented air conditioning, and sleeping upstairs, you had to have a window fan or you'd want to kill
Yeah.
yourself. But I don't know. Okay, so that's sleeping upstairs is an American thing around the world. They don't have it upstairs. Like countries with the lowest suicide rates in the world are in the Caribbean, like Antigua, Barbados, and Grenada. They're not sleeping upstairs, but it's hot. So that's my story, and I'm sticking with it.
Thank you, Darryl, for sharing once again. Okay. All right. Let's go to the next article if there's no other comment. This is something that we suspected, but now it's been confirmed that illicit drugs raise the stroke risk and heart attack risk, whether it's cocaine or amphetamines. Uh, they increase stroke risk among younger and older adults alike. So be sure to share that with your children and grandchildren and great grandchildren. And hopefully they'll leave the illicit drugs alone uh, because uh, strokes and heart attacks are not good things. And the more we involve in illicit drugs, the more likely we are to uh, have these unfortunate events. Any comment? I'm not sure anybody's surprised by this, but it is nonetheless something to share. And it's interesting that you point out, John, that alcoholism, of course, is not an illicit drug. we we approve it. So so that's why they put
It
it in
is,
separately. Yeah,
it is a drug.
yeah. Thank you for pointing it out. Yeah. Okay, we can go to the next article if there's no comment on that. Now, this is a medical fact that sentinel node biopsy is well known in breast cancer, but its impact in melanoma is that something that everybody seems to be aware of. And that just means you go in, you take out the nodes, and taking out the cancerous nodes improves the decreases the amount of people who die from melanoma, which of course is a fatal cancer. Um, and I just put this so that I don't know, not too many of us identify Black patients who have melanoma, but I know I had a good colleague who developed melanoma of the scalp and died. And what's that Jamaican singer who died from melanoma? One of the most popular singers in the world died from melanoma.
Belafonte.
No, no, no. A shame I can't remember his name. He probably has more Caribbean hits than anybody else.
Bob
Uh,
Marley.
Yes, Bob
yes,
Marley.
Molly,
Oh, Marley.
Molly.
Okay. Um,
Yes, Molly. Yeah, he
He
died from
died at
melanoma.
36 from acral lentiginous melanoma.
Yeah, right. Yeah. So,
I had an aunt that died from melanoma.
yeah. Although we tend not to get skin cancers, we do get melanoma.
Dr. Callender, what's the difference?
Difference between what?
Melanoma and skin cancer. I thought melanoma
Oh,
was skin.
skin cancers are usually easily curable, uh, especially if you catch them early. Melanoma is a different order of magnitude. It's a fatal illness. Most of squamous cell cancers, if they caught early, they are curable. With melanoma, it's very deadly. And so uh, doing sentinel node biopsy decreases the likelihood of you dying from melanoma. But melanoma is the uh, deadliest of the skin cancers. Okay, let's go to the next article. I think we have one or two more. Oh, this is interesting. Hydrochloroquine is treatment for rheumatological conditions, and they say 1 out of 18 patients who's treated with long-term hydrochloroquine is going to get retinal disease, which means you may go blind. So this is an important fact to share for those people who are on hydrochloroquine for any rheumatological conditions. To be aware of that risk and to seek a ophthalmology consult on a periodic basis. I don't know anybody who's on hydrochloroquine for long term, but uh, if you know anybody, this is just something to be aware of. John Buchanan?
I thought that was Trump's drug that he owned. Is that true? He was trying to recommend that for COVID.
COVID. I think he recommended it for COVID, but nobody paid too much attention to him. But yes, he did. Okay, I guess we'll go to the next article. I think we have a couple more. Now, this is something that is scary, that people who live close to nuclear power plants are likely to get cancer. And one of the things that is problematic is that not infrequently we're forced to live in places that are close to uh, toxic environments. And this is a toxic environment. And so, and you don't have a lot of choice of where you're going to live. But if they put you in a place that's close to a nuclear power plant, then the likelihood of your getting cancer increases. And this is scary. Uh, and this has been hinted at for some time, but now the data is crystal clear that if you happen to live close to a nuclear power plant, the likelihood of you getting cancer is markedly increased. I don't know where there are nuclear power plants, so I guess, but it's something to be aware of. So when they put you in a place that's anywhere close to a nuclear power plant, don't go. Now, one of the things that has been problematical is the fact that where do they put us to live? Where have we been placed? Whether there was a article or a lady, Brockovich, I think is the name, who identified the toxins that were in the water that caused cancer. Now we have a nuclear power plant, so living close to these power plants, wherever they are, increases your cancer risk considerably. I don't know how many were aware of this before. I wasn't, but anyway, it's food for thought in terms of where you live. Any comments or thoughts about this information? Lucy?
And where you have facilities, detention centers, things of that nature, where you are putting someone in harm's way, knowing that environmentally it's not safe. Especially, that's like death behind bars. Who's responsible? We've always been the people who live by train tracks and things of that nature, that side of town. Um, so it has a historical perspective on the value we put on populations.
Thank you for sharing. That's so true, so true. And it's always been the case that we've been placed in places where we really had little choice. Okay, I think that's the last article. Oh, Carol?
Yes, they always put things that are undesirable in poor neighborhoods, such as highways, because when they have discussion about it, we generally don't come because we feel useless. I was looking at the news last night. There is a mega mini store, something like that in Virginia. They have came out for hours and hours to protest that it was coming in, even though it had more jobs and everything, like Sheets or one of those stores. Also, it just hit America, period, like Walmart. There's neighborhoods, especially the rich neighborhoods, do not want Walmart in their neighborhood. They come out and protest, but very seldom do we even know that we have a chance to protest or say, not in my neighborhood? I don't want Walmart or McDonald's or something like that. You notice McDonald's and everything, they're not in Chevy Chase, Bethesda, high expensive, or even on the Gold Coast on 16th Street. They're generally in the poor neighborhoods.
So true. Well, thank you for sharing. It's been a very interesting session today, and hope we've all learned a lot. John Buchanan is doing such a great job with his articles. We can't thank him enough for the work he does every week. So kudos to John Buchanan.
And I also want to thank everyone. I will let you know my decision once I make it.
You don't have to let us know your
Response.
decision. That's your
Oh, yes. I mean,
personal
I would not be able to make it without having some of the input from you guys. So I'll let you know. But I'm going
And
to
that's
Okay,
why I
thank
say
you.
these sessions are very educational.
Oh,
I
yes.
have family members. What did we talk about today? And so I do that.
Pearl Lipscomb, did you have something to share?
Yes, it's not about anything that we actually talked about today, but last week I had a doctor's appointment. It wasn't with the typical physical doctor. It was with an audiologist. And after my appointment, the doctor told me that most people don't think about those types of appointments when they're thinking about, their physical care, and that most people should include an appointment with an audiologist as part of their regular physical regimen. Because as they say, hearing loss sneaks up on you. You don't realize it. So that they should just include an appointment with an audiologist along with the other appointments that they schedule. So I just thought
Thank you.
I'd mention that.
Thank you for sharing. Good advice. Good advice. Catherine, you had a comment?
I was just going to say there's a few articles that we did not have in advance. If John would send them to us, I'd appreciate it. Thank
I
you.
will.
But these were everything was very informative. I've invited a few more people to come. I hope they do.
Thank you so much. Thank you so much. Okay, thank you for sharing, and God willing, see you next week.
Okay.
Be safe, everyone.
Bye-bye.